The what ifs of central line care. What if my child needs a bath? The child with a central line should never be submerged in water, and it is important that the central line dressing remains clean, dry, and intact. If your child has a pick, they can get in the bath but must keep their arm out. It is best to apply press-and-seal plastic wrap around the pick site and tape above and below it. You can also use a plastic bag or generic saran wrap. If your child has a tunneled central line, you can similarly apply press-and-seal around the central line site and tape down all sides. Curl central line end up and cover both the dressing and the line with press-and-seal and a tape window around it. This does not mean that your child can soak in water. It will only protect against splashing. What can I use to hide the line from my child if they often grab at it or pick at the dressing? There are many options for central line vests and pick sleeves to purchase online. An easier, low-cost trick is to take a clean sock and cut the closed end to create a sleeve for your child's arm. You can also use loose medical wrap like Curlex, but do not use any wrap that compresses the central line, such as Coban. Any sleeve used should be washed and changed every 3 days or when soiled. What should I do if my child pulls out their central line? If the line is accidentally removed completely, hold pressure with gauze at the site to stop bleeding and prevent air from going into the site. Place an occlusive dressing, such as a Tegaderm, over that. Call the clinic immediately. What if I'm doing a dressing change and notice the sutures are out? The sutures are very important as they prevent accidental removal or displacement of your child's central line. Over time, sutures may become loose or come undone from the skin. If you notice this during a dressing change, finish the dressing change safely while being careful not to dislodge the line. Call the clinic. They may want you to come in for resuturing or plan to resuture at your next visit. What if my child's central line requires a securement device? For some kids, their central line may not be sutured, but instead they have a securement device, also called a stat lock. The stat lock must be changed with each central line dressing change and should be placed under the dressing to keep the line in place. Be sure to ask your nurse how your child's central line is secured. What if the line breaks or is leaking? If the line breaks or is leaking, place gauze around the line and clamp above the line break immediately to stop any bleeding. Call the clinic and bring your child into the emergency room immediately. What if the line will not flush? There may be a clot in your child's line if it will not flush. A clot is a clump of blood cells which can stick to the inside of the central line. If the line will not flush, do not force it. Call the clinic. They may have you come in to receive TPA, a medicine that helps dissolve the clot in the line. What if I am sterile during a dressing change and touch something outside of my sterile field, or need other supplies, or my child touches the exposed line? If you break sterility at any time, you should restart with a new pair of sterile gloves and replace any supplies that are not or may potentially be no longer sterile. Try to keep supplies nearby in a designated spot where someone else in the home could retrieve supplies for you as needed. If your child touches the line or site during the dressing change process, be sure to thoroughly clean before applying a new dressing. What if I do not have a small table I can use as my clean workspace? You can use any hard, non-wooden surface, like a clean unused cookie sheet or metal or plastic tray as your workspace. Be sure to have hand sanitizer and a trash bin within reach whenever doing centerline care. Always use disinfectant wipes prior to setting up your supplies, and let it dry. Please be sure to always ask your healthcare team any other questions or concerns you have. You are a crucial part in keeping your child's centerline safe and free from CLABSIs.